Yeah, good morning, everyone. And so I was asked to talk a little bit about my key populations, which is like the transgender women living with HIV. And most of you, I don't want to preach to the choir, would have like read this, or seen this, or at least sign up for the Global Advocacy Agenda and really look at a few different things, including human rights, access to treatment, and as well as helping communities to mobilize and organize, and activism. So the examples that I'm going to give you here is not necessarily a good example, but we can look at where I came from. I'm from the US. I live in San Francisco. San Francisco is one of the most resource-rich city in California. The Department of Public Health has a $1.9 billion budget, and we continue to receive money to support those who are living with HIV who are uninsured. With that kind of climate, let me share with you a little bit about what transgender women living with HIV is like. According to some of the research and data analysis, we know that about 87% of the women who tested positive have received care in the last 6 months, and 77% were linked to primary care within 3 months of testing positive. That's good news, right? Supposedly. And 65% of them are currently on ART, but only 35% of them had a CD4 count below 350, and less than half of them had a suppressed viral load. This is talking about a really resource-rich city with near universal access to treatment. And so it really didn't have to go further to really dig deep for us to ask more questions, like what makes it so difficult, to engage trans women, and what makes it so difficult to really get them to the point of virally suppressed. There are a few things that we know, is that there are a large group of trans women who tested positive are also IDUs, and also they are younger than the general demographic who tested positive, and they're usually trans women of color. When I say trans women of color, I mean they're either Black trans women or Latina trans women, and also when we look at that, their income level usually is very, very low. And so the next questions that we really have is, how can we change that? There's no easy answer for that, but a few things that I just want to also share with you is that currently there are no network, either globally or in any region, that is specifically for transgender women living with HIV. And I think that we've already heard some of the challenges, even from one of the strongest network around the globe, APTN, is the difficulty in engaging transgender women living with HIV in the network. There are reasons for that. And I think the reasons are shared by many people is that when you have been disappointed so many times, rejected so many times, discriminated so many times, it's not easy to trust. And I'm saying that because we have some indicators that if we actually build transgender specific services, they will come to us. When we have transgender-led organizations, they will come to us. In San Francisco, about 10 years ago, we started to look at employment opportunities for LGBT community members, but they had a really low turnout for the job fair that they held. They came to us, asked us what they can do, and we said that they need a job fair that's specific to transgender people, because then they know that these people are making an extra effort to reach out to them. And at the first transgender job fair, we had 150 participants. And that tells you how engagement is a real key into helping to empower the community and really find the voice of their own. What are we doing now? I don't know what we're doing now. I know what I'm doing now. So I'm currently working for an organization called Transgender Law Center in San Francisco, and we are hoping that we can look at different strategies, including legal interventions, legal advocacy, to help change, the structural barriers that transgender people living with HIV face. So we applied for some fundings, and it hasn't come through yet, so hopefully it would. And with that process, my hope and dream is that we can get to start organizing trans women so they could actually lead that effort and to look at what type of legal advocacy they need most, and that's where we can develop strategies on. And this also something that we would like to see on the global level. Currently the closest to a global group of transgender people advising many of the organizations, including Global Fund, is the International Reference Group of Transgender People and Gender Variant People. However, I think that there's still a value to engage transgender men and transgender women who are living with HIV, because that lived experience is quite different. And with that, I'm out. Thanks.
So I think the takeaway message from that really, Cecilia, is that understanding the needs and the issues of the communities that we're working with, the specific needs, is really key to meaningful engagement.